Robbie, as I said, is Research and Evaluation Analyst with Homeward Trust Edmonton. One of Robbie's major tasks is to track performance indicators for Housing First programs in Edmonton, analyzing strengths and areas in need of improvement. He wrote a chapter in the book Exploring Effective Systems Responses to Homelessness, released last week by the Canadian Observatory on Homelessness, download it, which proposes a method for forecasting what rate of housing is required to end homelessness. So without further ado, Jenny and Robbie.
So I'm going to run down quickly and in some nitty-gritty detail some of the data that Homeward Trust collects, and then Jenny's going to talk a little bit about what the province does. There are 7 cities across the province that do very similar work, and some of the data that they collect from that and how they use it. There are 3 major data sources that we have. Homeless Count, Homeless Connect, and our database of clients served. I'm not going to talk about Homeless Count and Homeless Connect today, but they're pretty significant chunks of information going backwards with surveys of roughly 2,000 clients per event that happens there. We've worked with 5,000 people. We've housed 5,000 people over the last 7 years, including about 3,500 clients on whom we have extensive data. And it breaks down into a few categories that we collect. Demographics, program enrollments, assessments, points of service, which is all the interactions between a support worker and a client, and a handful of other categories that the referrals are somewhat used. The other categories are available for individual agencies that may or may not use them, so I'm going to leave those aside for this presentation. I'm breaking every PowerPoint rule here and putting tons and tons of text on the screen. So just in case you are a researcher, you can delve into this and take a look and go, huh, we could do something with that. Or if you're not in a research role directly, take a look at it and start thinking about what questions could we answer with this information. I've tried to put most of the useful stuff down the left-hand side, what I think is the useful stuff. You might find other things on there. But these are the basic demographics that we collect. I'll note adult dependent. Anyone who's a client, who's over 18 but is not receiving service as a client, is part of a family and is not receiving direct service, is marked as an adult dependent. And then we record program enrollments. What program were you in? When did you start? When did you end? When did you move from one program to another within the Housing First scope? We have 4 programs that we consider Housing First. Intensive case management, rapid rehousing, pardon me, permanent supportive housing, and assertive community treatment. So if you see our program names over there, the first 3 are before housing, the next 4 are housing programs, and the graduate program is where we work with folks who have maintained their housing independently successfully. We do a whole bunch of assessments. The SPDAT, the Service Prioritization Decision Assistance Tool, did I get that right? Minor miracle. Happens before housing, at 30 days, and then every 3 months, along with any significant changes or rehousing, and at exit. And that looks at 15 areas of well-being. There are a set of assessments that are done right across the province in all of the 7 cities that have some more detailed questions at housing, 3 months, 6 months, 9 months, 12 months, exit. And then we in Edmonton also use a housing placement form, which tracks details on income and rent and helps us administer the rental assistance program, but also actually provides a pretty rich source of data in looking at the rents our clients are paying, the level of support they need, the level of income they have. Unfortunately, it's updated, and so it's hard to track over time. As rent changes on a form, it's simply replaced. But it gives us I've got to stop doing that. A reasonable cross-section of data pretty well. And this is a selection of the kind of questions that get asked on the provincial assessment. They're not word for word. I've tried to cram them down and get them onto the page so that you can take a look at them. If you would like the full list, grab my card, contact me. We've got a layout where we can take a look at the full thing. But there are questions like about education and training, about foster care, about domestic violence, about what services you've been discharged from, how long you've been homeless, and then follow-up questions looking at have you been rehoused recently, how often are you in contact with a caseworker, and at exit, what's your current housing situation, and why is the client leaving the program, which are a couple useful evaluative questions in asking how successful we are at maintaining housing. These are the 15 SPDAT categories I laid out. Each of them are scored 0 to 4. On the version 3 that we use, 4 is high acuity and 0 is low acuity, and then you total that out of 60 across the 15 indicators to get a sense of prioritization. And most of our points of service, our interactions between worker and client, are set up on those SPDAT domains, which allows us to look at whether we are working in the areas of highest need with a client. But there are a handful of others that simply are common features of case management and are placed in there as well. And for each of these interactions, we record the contact location and method. Was it a face-to-face interaction? Was it a text? Was it an email? Was it at the client's home? Was it at the worker's office? Was it out in the community? Was it an interaction with the landlord? So a bunch of those are captured along with the time spent on the interaction and who is actually physically there. So that's my quick rundown of the kind of data that we collect, and much of that, it's a little bit different for things like points of service across the province. The provincial assessment is the same across the province, and I'll let Jenny talk a little bit about how Human Services uses that information.
Hi, good morning, everyone. I'm very happy to be here, and as behalf of Human Services, Government of Alberta, and the data management and reporting team, I feel a little bit pressure, and because I just come back from China and yesterday, and I think my brain still speak Chinese, not English. So I hope, and I can beg your forgiveness, and if I have a little bit of difficulty for the speaking English. And you can see I bring my notebook here because I just come back and know I will do this presentation to present our data team, so what type of data we collect and what data source we have, so how we can support you here and community services provider and researchers and even our internal government, other like policymakers. So yes, and we have lots of data. And then even through lots of meeting and the conference, I heard all the people and the leaders talk about data. Yes, we are play the supportive role. And then the question always come to my mind is think about, yes, as a government data team, how our data can be collected to meet your needs. And because we receive lots of questions, say, okay, government over collect the data, or government collect the right data or not right data. And because everybody knows good data is essential for us to do the policy making, to support the decision making, to support the research. And everything is about the data. So, and then people ask, so what type of data do you have in the government and in your shop? Okay, so what type of data? And our data team specific from like homeless supports and the division and for the policy integration, program policy integration branch. And we have 4 data sets. So these 4 data sets is related to the homeless. And the first one is Housing First program data. And the second one is adult shelter data. And the third one is women emergency shelter data. And the fourth one is youth homeless data. So we have these 4 data sets, but it's lots of data. And because Robin mentioned that just only from Edmonton, so we manage cross-province like 7 CBOs and data. And then the data we collect, I think, and based on my knowledge, I started my job just 4 months ago, and is since back to the 2009. And I am still learning, but I know very firmly, confidently, in governments, our center management work very hard and try to provide the support to our 7 CBOs, community partners, and for the data, and specifically the data management and the reporting piece. And as you can see, and specifically for this 4 sets of data, and I want to emphasize the HMIS is a homeless management information system. So how this system work at prevention level and to support our data management. And then, as you can see, there are many functions at prevention level. And the first one is just HMIS as a data collection tool. So we use this tool to collect data and from service providers and to form the data pool. And in the data pool, we have different level data. And even you can see interpret the data into different level. And it can be into like client-based individual level, can be system level, can be like outcomes, measures, and level. And based on different level data, and we focus different usage, how we use the data in the different level and in the different purpose. And also this data, and specifically this data, and we use in the government and in the 3 key areas. One key area is the policy decisions and how we change the policy, improve the policy, or make the new policy, and also the program decisions. The program is doing well or not doing well. So how we can do different, and even how we can design the different program and to support the homeless, to end homeless. And specifically, we have like Alberta Plan for Homeless. And this plan is implemented, this is the 7th year. And after the 6 years, and when we look at the program, and specifically Housing First program, is this program working very well in some degree, or in some degree, could we do something differently? And could we improve something? And then also for the investment decisions. So how we do the budgeting, and how we support the budgeting process in the government to support different program area. And then all this data is to support the initiatives and activities in these different areas. And then we talk about how the data we can use. And because the question asked, the data is correct, is right, is meet the needs for us to collect. And because we received some questions, say, we have so many data elements in the data system. Is this data elements really inform something? Or is this data elements necessary in the system? And is necessary for us to collect this data? And then I think there's research and even the work, and we have many projects in our team, and to do this type of analysis, and to look at and some questions, and even some assessment. Robin mentioned specifically from service provider perspective. So we do the intake assessment for any and inclined to come to the shelter services. And for this intake assessment, we asked so many different level questions. And through these questions, we collect the data. And all this data is self-reported data. And the self-reported sometimes creates a challenge for us. And when we sort of the data, when we interpret the data, and how we reduce some challenges, and all these type of things, and through our project. So we have the project to look at our data elements. We have the project to look at how align the data management to support the research, to support our service provider, and to support our government and the policy, like decision-making process. And the data right now at the provincial level, and how we use the data, how we interpret the data, and we through the regular quarterly reports. And all these reports, the information, so we pull out from our data source, include like from HMIS. And HMIS specifically, we create like community profiles. So we have 7 community profiles to reflect and the different CBO, and to look at, to reflect different programs and the different services provided and cross province. And also we have caseload reporting, and this reporting and provides the information to the executive team and executive council for the center managers to look at how government and provide the supports to the services we provided for the homeless supports. And also we have the specific reports to reflect on the emergency shelters occupancy rates. And I think the lots of research data requests and come from this type of data, and because they want to look at the people stay in the shelter and how many clients we dropped in, how many clients we housed, how many clients graduate from a Housing First program. And from all this type of data, we can track in program performance and look at the progress and even look at the changes. And also we respond to requests, to respond to lots of information requests. So this information requests come from different level, and some requests come directly to government, some come to our shelters, and some come to CBOs, and we have external requests and internal requests, and 5 different types requests. And the governments right now implement the information sharing strategy, and we have the policy involved the FOIP and involved the PIA assessment. So this type of things impact how we process the requests. And because sometimes we try really hard to give you support for your data requests and information requests, and sometimes maybe you will experience some delay, and then I appreciate many researchers, many organizations, patients, and to wait for us response to your request. And because in the government we have a specific process to process your request and then policy to your request. And specifically right now, and our data team is working on to improve our response process to your data request. And some people say I didn't receive the data I requested for 2 weeks or 2 months, and because of like some level approve involved, some policy we have to follow. And right now, and my team is working on specific projects and to respond your data requests. We have internal process package and external process package. So once this package is completed, we will share with 7 CBOs, and you can have all the information you need how to request the data to access our data system and to get the data needs and for your research purpose or the performance measure papers or the evaluation, a program evaluation purpose. And when you request this data, and then we have right now in our system, and we have data available includes shelter usage, population demographics, self-reported experience with health and justice systems, and the performance measures and effect indicators of Housing First program. There are just some examples like how we used our data, and then I can give you more details, and if you have any questions related to these examples, and we can have further discussion during our question and answer sessions. Thank you, everybody.